Hello, welcome this evening. Welcome to our fourth COVID Facts Not Fear Town Hall discussion. This is our final in this particular series, sponsored by the African American Council of Elders and the Black Alliance. We're just going to talk a little bit about COVID and what's going on right now. Currently, with regard to the pandemic nationwide, there are about 19 million cases with about 332,000 deaths at this point. In the state of Kansas, we have about 213 cases with about 2,500 deaths. And in Sedgwick County, we are about 37,000 cases with 256 deaths. Right now, unfortunately, we are leading in the state of Kansas. But we continue to work harder here in Wichita to do what we can to combat COVID and keep our cases and deaths down. The Council of Elders and the Black Alliance have continued with our collaborative Facts Not Fear outreach, education, and assistance campaign. One part of this campaign has been our free text alert system. And if you watch along the bottom, there will be on that ticker, it'll tell you how to get onto that text, but you dial 484848 to get updates on healthcare and other issues that are important to the Black community within Wichita and the surrounding areas. Also part of the Facts Not Fear campaign has been a series of virtual town hall discussions to provide not only the African American community in Wichita with valuable information, but Black communities nationwide with what we all know in order to make sure that we survive. As we have been talking about all of this, one of the things that we really are trying to emphasize is that we're all in this together. At the end of the day, whether you're Black, whether you're brown, whether you're white, whether you are whoever, if you live in this community, if you live in this nation, this is affecting you in some way. Last week, we discussed the effects of the pandemic on mental health in our communities, and tonight, with the introduction of several COVID vaccines, we want to discuss the very serious issue of should Black and brown people take the COVID vaccine, why or why not? Tonight, we have a couple of panelists on for you. Our first panelist is Dr. Rita Stanley. We talked to her last week. She is a Kansas City-based internal medicine specialist offering alternative and holistic health services. Welcome, Dr. Stanley.
Thank you. Good to be here.
Next, we have Dr. Reagan Dehart. She is a family practice physician with the Grace Med Health Clinic here in Wichita.
Good evening.
Welcome, Dr. Dehart.
Thank you.
All right. We also have Dr. Maurice Duggins. He is a family physician with Ascension Via Christi Medical Center in Wichita. Welcome, Dr. Duggins.
Thank you, Van. It's good to be here.
All right. And our last but not least is Dr. Dennis Oyango. He is a pulmonary and critical care specialist at Ascension Via Christi. Welcome, Dr. Dennis.
Thank you so much. I'm happy to be with you tonight.
Awesome. We are going to have a great discussion, and we want to remind you that because we are live, because we are on Facebook, feel free to pop your questions in there. Feel free to ask questions. We want to make sure that your questions are being answered. Of course, I have some questions, but we want to make sure that we are answering your questions. All right, my first question is going to go to Dr. Dehart. And I know that you are in a clinic, and because of that, you're working with families in that clinic. You're dealing with African American and Hispanic families. What are you telling patients about the vaccine?
Well, I tell them that it's safe. I've already had my vaccine last week. The only thing I experienced was a little bit of muscle pain in my arm for a couple of days. If you have to weigh the risk against the benefits. Our risk is becoming very ill, if not dying, versus the benefit of living. We are at that point where we are getting close to its life or its death. We still don't know what we don't know about this disease. We don't know who it's going to affect in the most severe manner. So we have to take it. Got to take it.
So, as you're looking at those different populations, so as you're looking at the various populations that are coming through the clinic, is there a particular thing that you're seeing in common with your patients?
Absolutely, especially in our marginalized populations, our Black and our brown people. We are the people that are working on the front line. And the definition of front lines is evolving. You know, first we thought police officers and firemen. We forgot about the people who clean in the hospital. We forget about people who clean up in the stores that we frequent. And these are our people who have lots of chronic health problems, people who are already of lower socioeconomic status. They can't take off work. They don't have COVID pay. They have to support their families, so they go to work whether they are sick or well. And these are the populations that I serve. These are the populations who are at greatest risk right now.
Thank you. Thank you. I do agree that when we started to look at that ideal of frontline workers, when we started to look at who are the people that are out there, we didn't think about the people that are getting our groceries, the people that are cleaning, the people that are doing some of those jobs that we don't think about, that are kind of undercover. But if they weren't doing them, we would have real issues. Getting the things that we do every day done. Even that person that's picking up our trash, because you know there's some level in which there can be some contamination there. And so I think those are people that we haven't thought about. And so I appreciate you bringing that up. Dr. Onyango, I understand that you at some point did contract the virus, correct? So kind of tell us a little bit about what that experience was like for you.
You know, I think fevers and sweats and muscle aches, you know, which is like, I didn't know what it was initially. You know, I thought, you know, it was just something coming along, tried to shake it off. But the week before, I'd been taking care of a patient that was very sick. And I thought I'd been exposed to him. After 1 week of muscle aches and sweats, that's when I started having a cough and shortness of breath. And it was scary. The biggest thing was the anxiety of not knowing, you know, what to expect. And given my practice, I'd seen a lot of patients suffer and die from it. And so I was also anxious, you know, that the same before me. And so it was a very trying moment, at least 3 or 4 days when I thought I was, you know, the most sickest, with a lot of cough and shortness of breath. And then slowly things started getting better. You know? And it was a relief, you know, that I felt like I was getting better after maybe a week or two.
Wow. So as you think about that, was anybody else in your household affected?
No, not really. Fortunately, you know, I live away from my family. My family is in Kansas City, and I live in Wichita. And I have to visit them. But by the time I was visiting them, I was having symptoms. But I didn't know it was COVID at the time. So I mean, I was interacting with them as usual. And then when I came back, that's when I tested positive. But luckily, I think by the time I was showing up there, I was probably not as infectious. So they were all negative. So it was a relief for me that all of them got negative. So I didn't expose anyone, at least to my family.
So do we see that as being an issue in the fact that because the symptoms are so similar to the things that we would have going on in the fall anyway? So I could say, you know, this feels like my allergies. This just feels like maybe I worked out too much and I'm sore because I worked out, or maybe I have a little touch of the flu. So how are we telling people what are we doing, and how are we having those conversations so that people really realize that this is not just the everyday run-of-the-mill things that they would be getting in the fall?
You know, unfortunately, what you're saying is very right. You know, earlier on in the symptoms can be very mild. You know, they can be like a little bit of muscle ache, maybe sweats, maybe a little bit of fever. And by the time people realize that they're sick, they've already, you know, spread it to other persons. You know, so people have to be very vigilant, you know, with mild symptoms, to be very, you know, vigilant that whenever they have any symptom that's unusual, they should think about getting tested. Unfortunately, you know, people don't know. By the time people get sick, it usually tends to be around day 10, day 14, and when the symptoms tend to be more severe, and people get more concerned. And by that time, they've already spread it to their family, you know, and their friends, and they've all been, you know, exposed. So the best thing that people can do during this time is to be more cautious by wearing your mask, staying away from gatherings, staying away from exposing other persons that you don't know if you have it, you know, because by the time you realize that you have it, you've already spread it.
So one more question for you, and then we'll move on. I know that you are a pulmonary specialist, and a lot of this disease really affects our respiratory system. And I know from experience having a person in our congregation who had it Stroke can happen as a side effect. So, what are you kind of seeing in the pulmonary respiratory situation that's happening?
So I would say the last 9 months, I think I would say they've been agonizing 9 months. We've seen a lot of suffering. People come in with shortness of breath, they can't breathe. And initially when they come in, they look like they're having just a little bit of struggle. But as time goes by, as the disease is catching up with them, they get more and more short of breath to the point that we have to put them on a breathing machine to support the lung. Because what the COVID does, because a lot of inflammation in your lungs, and your lungs get stiff. Usually the lungs are more like a balloon, so it's very easy for you to inflate in and out and breathe in and out. But as you get a lot of inflammation, the lungs get stiffer, become more like leather. And so your walk-up breathing becomes very difficult. As a matter of fact, today I was just seeing a patient, and he was telling me, I'm tired, I'm tired of breathing. I can't do this anymore, because you can't get any comfortable position that you can feel comfortable in his breathing. And I saw another gentleman as well say the same thing, saying that, when you look in his face, you can see a lot of despair. Initially, when he came in, he was very optimistic, but right now, as the disease is catching up with him and he's getting weaker and more short of breath, and you can sense in him that he's sensing that maybe death is imminent. So you can look in his eyes and you can see that he has fear. He's afraid of what's coming. And unfortunately, when you try to reassure him, you've seen a lot of the same cases before. You've seen what's happened to them, and you can try to give him some hope, but the hope is not there. We know that it's likely more than not that he's going to end up on a breathing machine and eventually possibly die. So the lungs get really damaged. People get scarred. We've seen patients stay in the hospital for more than 2 months, 3 months, and even then they've not recovered. They still need some time to recover, so they lose their jobs, they lose their livelihood. People have lost their loved ones and family. So it's a multi, I'll say, affects multiple systems and multiple livelihoods in patients' lives.
Do you see the question down below? How long did it take for your oxygen level to kind of level out?
No, I was lucky that my oxygen level, got down to 92%. So it really didn't go that low. And I would say maybe because of my age, and being healthy, I would say, because I was a little bit active. So I didn't get that sick, but all the persons, who have other risk factors that we know about, right now we see people who have diabetes, who tend to be mostly African Americans, people who are obese, because of the socioeconomic issues tend to be African Americans, and older. Those tend to have severe disease, and that's what we're seeing in the hospital. They tend to get much more sicker, and the oxygen drops down. Usually, if you're going to recover, it will be probably around 2 to 3 weeks before you start seeing some improvement. But I've seen patients be sick for like 2 or 3 months. So,
wow, Dr. Stanley, I see you saying yeah. What are you seeing? I know that you're in that Topeka, Kansas City area. What are you seeing happening?
Now, I'm not on the front line, so I'm not in the hospital. I'm not in the ICU. I do more outpatient functional medicine, but I've done telemedicine for the entirety of this pandemic. So back in March, April, May, just constant telephone calls from people who were having symptoms. They were just hearing about COVID, didn't know whether they had it, testing wasn't available. So spent a lot of time and had to learn rather rapidly about this new infection. I mean, it's a novel virus, and everybody has been learning along the way. So my experience has not been one-on-one in an office setting or hospital setting, but primarily on the telephone. And at one point, when New York was an epicenter, we actually had limited ability to actually practice. And I was talking to people in New York and New Hampshire and Delaware because their systems were so overwhelmed and people couldn't go into the ER. They couldn't go to their doctor.
Wow.
So a lot of it was around education and helping people understand as much as we knew at the time. Helping them understand the symptoms that they can't ignore, even though, yes, the ER is full of people with COVID. If you're having shortness of breath, you can't breathe, you got chest pressure, you need to go have some in-person care. So lots of education, lots of encouragement, there's lots of anxiety on there. So what I've seen has been in that role. And it did get better, but now it's ramping up again. We're heading into flu season. Like you were saying, people don't know, what is this? Is this my allergy? Is this flu? And literally, you cannot tell them, oh, this is just your sinuses. We can't, I can tell you, it sounds like it could be just routine sinusitis, but in my mind at this point, because there's the rates of positivity are so high, it's COVID until proven otherwise. And I'm not trying to be paranoid that everything is COVID, because people still get common things. However, to me, the worst thing we can do is just to blow it off, treat it with antibiotics, which are not going to help COVID, as far as I know, certainly not as an outpatient, and direct them to get testing. And fortunately in Kansas, or at least in the Topeka area, the testing in asymptomatic people has become more available, because up until really the last couple of weeks,
Right.
had to have symptoms in order to be tested.
True.
So it's going to be interesting to see what our positivity rate looks like as the testing is more widely available. I think the number will come down some, but yeah, for me, it's been a lot of supportive guidance, directing people to get care, when to get care, and also in my own personal practice, really helping people understand that they do have power around some things, like what they're eating, about knowing what their vitamin D level is, or if you can't get it checked now, then still, based on a lot of the science that's come out of this pandemic, vitamin D can help, particularly in people of color. So a lot of mine is just letting people know you do have control, you do have some control. We don't have treatment for mild symptoms or asymptomatic disease, but you have control over what you put in your body so that your immune system will have a better time of doing what it's created to do.
So last week you brought up, when we talked about the vaccine, and you brought up something and you said, at the end of the day, I will take it when I need to take it because I want to live. And Dr. Yanga just said the same thing. So tell us a little bit about that. What is, I think there's this fear of the unknown.
Sure.
And so, the vaccine is unknown. We don't know. Dr. DeHart said she took it. She didn't really necessarily have symptoms, but it's still new. It's a novel thing at this point. And so, that ideal of I want to live. What are we having? How do we have those conversations?
Well, we understand why there's so much mistrust in our community, especially based on some history. But I also think I think it's interesting that we're in Kwanzaa. And I love the 7 principles of Kwanzaa, and they speak to this pandemic as far as I'm concerned.
I would agree.
Unity in the community, self-determination, making sure that it's a collective work. So when I say I want to live, I'm really saying I want to live for me, and I want to live for the people around me. I want to live for the children and the older people. I want to do what is right for me by getting the vaccine, but I also want to help people as much as I can to really understand the facts around these vaccines. And so we can put to rest some of these fears based on lack of real actual facts. So to live for me is not to just live for me. For me to live means that other people will live that I care about.
Dr. Yanga, you wanted to say something on that? And then we're coming to you, Dr. Duggins, I promise.
Oh, sure. I wanted to add to what Dr. Stanley's mentioned. As it is right now, I think we have to think about what the alternative is. And the alternative, what we have right now, is that we have no effective treatment for COVID-19, COVID-19 disease. So then when you look at the way people are suffering, and like I told you about the gentleman that I saw today, I'm sure if I offer them a vaccine, they'll be willing to take it. And even right now, I think since March or maybe April, we've been giving people some kind of sort of vaccination that we're using. It's called passive vaccination, passive vaccine. What we're doing is we're taking other patients' plasma that have recovered and giving it to patients who are sick. Unfortunately, that does not work very well, because by the time we're giving it to you, you're already sick with the disease. So it's better to train your body before you see the disease. And so by the time it's coming towards you, at least you can fight it off. So the vaccination idea has always been there, and we've been doing it, already, but it's very ineffective what we're using. So what we have right now that's coming up I think it's the best vaccine so far that we should be running to.
Thank you. So, Dr. Duggins, I saw you on Facebook the other day. You got your vaccination, and you were getting it on Facebook. Tell us about that.
Yeah, I being in one of the frontline people, I figured I needed to go ahead and get my vaccine. It's not just for me, but to help protect the people around me, my family, and my community. The community itself needs to have an example that it's a safe vaccine to be taken. And if I'm going to put myself out there to take it, hopefully they'll recognize that it's, if I think it's safe, that hopefully they'll think it's also safe. It's been tested with thousands of people, and it has demonstrated good efficacy. So we just needed to get enough people comfortable with the idea of being vaccinated instead of dying from COVID, like so many have already. We unfortunately have too many African Americans dying disproportionately from COVID. Again, as Oyengo said earlier, and as Dr. Stanley and Dehart alluded to, there's a disease process that affects us disproportionately. There is the fact that we also have so many people that work in the service industry and essential workers as well. So it's important for us to get the vaccine as soon as we have it available. I was recently informed that they're bringing it into the community through some of the FQHC centers that we have, the federally qualified health centers that we have in the community. So that's good because I think that will also get more people vaccinated.
So did you have any side effects?
My only side effect was the following day, I felt some soreness in my left arm where I got the shot. Beyond that, nothing. It was all good. It's from other than the soreness in the deltoid. So I was good. I didn't have any weakness. I didn't have any slowdown in my work activities. I never got a fever, nothing of the sort. I just went along with my regular daily activities.
Okay, so here's what we're going to kind of open it up. I'm going to just ask some questions because I want us to have a little bit more discussion. Okay, there is this whole concept that when you get a shot, when you get a vaccine, that they're giving you the disease. Is that true?
No, not really. The vaccine, there's different kinds of vaccine. But this vaccine, what they're doing is they're giving you a protein that's similar to what, it's kind of a precursor to a protein that's similar to the virus. So your body then gets trained, by seeing this protein, which mimics the virus protein, and then your body then can learn with time to fight the virus when the virus comes through. The protein that we're giving you is the most important part of the virus. So when your body sees that, you can at least learn how to fight it. If they're talking about getting a virus, the flu vaccine is a virus that's been weakened. So if you get like a nasal spray, that's a live virus. And we've been giving people the flu vaccine for a long period of time. And
so there is a difference between how the flu vaccine works and how this particular vaccine works.
That's correct, because this vaccine is not a complete bacterial virus for that purpose. It's just part of a protein on the virus itself. So it's not going to multiply in you, or you cannot spread it to someone else if you got it. So it's totally different compared to the flu vaccine or even the polio vaccine, which actually, if you got it, you could easily spread to someone else.
Okay. What were you going to say, Reagan?
Oh, I was going to say that the reason why everyone is so excited about this vaccine is because of the science that has gone into it. Over these hundreds of years of research on disease, we have figured out a way that we may be in the future be able to fight almost any kind of virus through a technology called mRNA, messenger RNA, which is part of our cells. It's a signaling. It's a signal. There's a signal in this vaccine. It's not the virus. It's a signal from the virus itself. We now have the technology that we will be able to emulate signals from any kind of virus potentially that our population comes into contact with. That's why we're so quickly, once they found that technology and they quickly brought that to the market, that's why we're so excited about it. Me personally, I had some pep in my step, honestly, after I received my vaccine last week. I, like Dr. Duggins, had some pain localized in my arm where the shot received the day after, not even the day after. The day after I woke up, my arm was a little sore, but I felt a pep. And I know that was mostly psychological, but we're part of history. We're becoming part of history. So that's exciting, and that's a way to hopefully inspire our patients.
So as we look at, go ahead, Dr.
I was just going to say, and the two that are available now that got the emergency use authorization, that's the Pfizer and the Moderna. And those are already being given in this country. Pfizer was first. Did you all get Pfizer or?
Moderna.
Moderna.
I got Pfizer.
Yeah. And they're both the mRNA. And I agree with you, Dr. Dehart. I'm fascinated by that technology, just intellectually, but just knowing that they've been able to get, I call it the recipe, the mRNA, the recipe for the spike protein on the virus. So it's very specific to that part of the virus that attaches to our cells and causes the infection. So if we can develop neutralizing antibodies to that spike protein, then the likelihood of us, now what we don't quite know is, do people still get infected after the vaccine? What we do know is people don't get the severe infection, which is killing Black people, people of color. So it's really powerful, the fact that that has come to bear right now during this pandemic.
So the question is, and this was the question that we were going to ask next, if you've already had COVID, should you get the vaccine?
Yes, you're encouraged to get the vaccine even if you've had COVID, because we don't know how long your immune system is going to be able to protect you. I've had several of my peers who've developed COVID still come through and have the vaccine taken. And the CDC has encouraged anyone who've had COVID to still take the vaccine. There's some who've actually gone through and checked their antibody levels and felt, well, they can wait before they take it. But most people are not doing that. And it's recommended if you've had it, just go ahead and take the vaccine.
That was getting ready to be my next question. So we have this whole piece of, I've got the antibody, I don't need to worry about it. And if I have the antibody and so literally somebody just told me this the other day, I don't have to worry about it. I got the antibody, and my doctor told me that every time I come in contact with somebody who has COVID, that my antibodies get strengthened.
And I think the concern is we don't know how effective. You can have measurable antibody, but the real question is it neutralizing? Is it effective enough to keep people from getting, because there have been people who have been reinfected, not a lot around the country, around the world, but so there's still a question about whether presence of antibody equals effectiveness of antibody.
And the other issue is, people don't know how long the antibodies are going to be around to protect you. I mean, initially we thought it was 3 months. People say maybe 6 months. So it's not really clear, how long those antibodies are going to be around to protect you. So with the vaccine, at least you're given at least the same thing, 3 months or more, before the protection can wear off.
So you all took the vaccine. Do both of you need to get a second dose, or which needs a second dose?
Both of them. Pfizer
Both of them. Okay. And so how quickly do you take that second dose?
3 weeks for the Pfizer vaccine and 4 weeks for the Moderna vaccine.
Yes.
But everyone has to get 2 injections, recommended. However, from your immune system is activated from the first injection, and it's actually building up those antibodies from the first injection. The second is like a booster to just get it over the top, increase the efficacy of protection for you.
Yeah,
go ahead, Dr. Stanley.
The studies have shown that even after 1 injection of Pfizer, I think there's 50% effectiveness. But you still want to get the second one. You don't want to be happy with 50.
Effective how quickly?
I think I read where it was like 2 weeks. 2 weeks after the first injection, they were able to measure enough of the antibody to say that there was 50% effectiveness.
So if I go get a vaccine today, is there a period of time when I still need to probably be very cautious before, it kicks in, if you will?
Oh no, I was saying throughout.
We still need the same level of confidence from day 0 as on 6 months down the road. We can't let off the gas with our mitigation efforts of wearing your mask, avoiding crowds, washing your hands. Just because we have the vaccine does not mean that we're 100% safe. What it is that if we come into contact, we are less likely to develop severe illness that could be life-threatening. We could still possibly catch COVID, though it is more likely that it will be a mild case.
So let's reiterate that, because I want people to be very clear about this fact. Just because you get the vaccine does not mean that you cannot get COVID. It just means that it will not be as severe. Just like if you get the flu shot, doesn't mean that you won't get the flu. It just means that you're probably not going to die from it.
That's right.
So I want us to be very clear about that we want you to get the vaccine, but we want you to also be very conscientious that getting the vaccine does not give you the red flag to go out and do whatever you want to do and be like, oh, I have the pass.
That's
Correct. And you want to encourage other people to continue the mitigation system, as Dr. Dehart said, because you don't know who else in the community hasn't had the vaccine to that date. You may have had it, but they may not have had it. And you may actually be encouraging people to expose other people who are not vaccinated to the virus. There's a chance, which hasn't been proven yet, there's a chance that even after you've gotten vaccinated, that you could be transmitting the virus for a certain time. So it's best, if you've gotten the vaccine, go ahead and continue to do the mitigation things. Wear your mask, wash your hands, and avoid large crowds. If you're in a crowd, make sure you're wearing a mask. And minimize the amount of time. Minimize the amount of time that you're in any crowd, because once you get to a certain amount of time, 15 minutes or more, it can make it more likely for you to get infected.
Is there anybody that should not take the vaccine?
Yeah, so I think the first that I will think about is in the studies that were done, there's some people who are definitely excluded from the studies, and what comes to mind usually is people who are pregnant, or expecting, so for those persons, I would say that they should not necessarily get it, but you have to discuss with your doctor based on your risk factors, because you could be at high risk, from dying from it. And so you have to make a decision as to whether to get the vaccine or not. And if you have diabetes, you're obese, those patients seem to do worse with COVID. So I think it would be better for you to discuss with your, doctor first before, thinking about getting it or not. But definitely people who are pregnant were not involved in the study. So this will be the first category I would say they should not get it. The other category is, younger persons who were studied were more than 16 years of age. So young persons were not studied in this studies. So they're not also eligible for this vaccine so far.
Okay. Anybody else that we would say needs to, someone asked if they have COPD, should they get it?
Oh yeah, definitely. COPD is one of the, high risk categories. People who don't fare very well if they get the disease. So definitely, if you have COPD or any lung disease or diabetes or heart failure, you need to get it. If you have concerns, because of your disease, the best thing is just to call your doctor and discuss the options, see if you should get it or not.
Yeah, one more thing I would add, it's anyone who have had any severe reaction to vaccines before, they need to also discuss that with their physician, because their physician may actually have to advise them either not to do it or use certain precautions if they go ahead and do it. For example, there was a physician himself that went ahead and took the vaccine, but he has his EpiPen, which is sort of a rescue drug, because he knew that he tends to have severe reactions to the vaccine. So he was ready. So when he got it and he had his reaction, he took his EpiPen and he was just fine after that.
So that was one of the questions that came up, is if you have allergies, should you take it? And so again, seeking your physician and looking at what your particular allergy is would be the most prudent thing for you to do.
That's correct.
Okay, so there's a question, and Dr. Stanley, this is in your lane. They said, what can we do? What should we be eating? What should we be taking to boost our immunity? And I know that you are a huge proponent of food as medicine.
Yes.
So talk to us a little bit about that. What should we be doing? What should we be eating? What should we be taking right now to boost our immunity?
Sure. And, most people know what I'm going to say intellectually. We've heard this. But there are certain things that your immune cells are either going to benefit from or it's going to be a detriment. And I'll say sugar, simple carbs. Sugar actually does a couple of things. It actually blocks the uptake of vitamin C into the immune cells. And we know that our immune cells. So the more sugar and simple carbs that you have, it's going to make your vitamin C less effective in supporting your immune cells. So, and we always are, during this pandemic, comfort food has been comfortable for us, but it has been a detriment because the more we eat comfort foods, the more inflamed we become, because the sugar causes inflammation. COVID is an inflammatory disease because when you look at the immune system is beneficial because it creates inflammation. When we see patients get deathly ill, it's not because the immune system wasn't working sometimes. It's just that for some people, it's like our immune system dysregulates. So in the process of trying to kill the virus, it produces a lot of different cytokines and things that are detrimental to the human body. So I start with sugar. I mean, sugar should be limited as much as possible. Certainly, eating green, leafy, we know this intellectually. Eating vegetables and fruits, limited fruits, because you can get in trouble with that sugar. And I know some people don't have ready access to that. But I think that all of us can do better, even if it's just limiting, drinking more water, getting more rest, getting 7 to 8 hours of sleep. Those things that we think are not important are extremely important. And for people of color, again, I can't overstate this. You absolutely must support your vitamin D level. And right now, it's not a perfect scenario. Some people can't get the levels measured. But you can assume if you are a person of color with pigment in your skin, your vitamin D level is less than 50. I can only tell you my experience with hundreds of patients in my functional medicine practice. I don't think I've ever seen a person of color have a good optimal vitamin D level. And one thing that this pandemic has revealed, and now there are studies that have come out of this pandemic that demonstrate the association of low vitamin D with not only getting infected, but in severity of COVID disease. And so, I'm not going to use the word treatment, although there's a couple of studies that use that word. But I can't tell you if you don't do anything else, support your vitamin D. But certainly you can make some dietary and other lifestyle changes.
Dr. Dehart, you're shaking your head. Are there any other things that you would suggest? You're muted, baby.
Yeah, I agree with all of those things. And one thing we said is about our access to, healthy foods. And like this disease has really brought to light the disparities between the haves and the have-nots. In the population that I work with, you can't even always say between, black and brown and white. It's between the haves and the have-nots. In our population, they don't always have access to healthy foods. There are foods that they eat things out of a box. And those are the foods that are highest in those simple sugars and the high fat. They don't live in neighborhoods that are safe enough to get outside and exercise. We're in the dead of winter where there's no sunshine and access to sun to activate our vitamin D. So the most simple thing that I've been able to tell people is stay away from the fast food and at least take a multivitamin. That's and drink more water. Stay away from alcohol. try your best to stop smoking. And so we have to give each other grace, and people, all we can do is the very best we can do. So if the best you can do is to take a vitamin and get outside and walk up the block and back home, a few days of the week, please do that.
Yeah, I would totally agree. So our comfort food needs to be green vegetables. So we need to be eating greens and cornbread versus cookies. Is that what you're saying? No, I mean, come on now. You got to give me something. Come on, Dr. Stanley. Come on. We have this conversation all the time. I mean, you got to give me something.
I'm hardcore, and I don't know whether it's because I'm older, and I've actually seen people do these things, even when they don't have great access. So my thinking, and I think it's because I am older, and there's just so much power that we do still hold. And I don't shame people, I don't beat people up, but I'm going to make sure you have that information so that you can make the choices when you can make the choices, because there just isn't a whole lot. And if we're going to live and live well, even beyond this pandemic, yeah.
Hey, do you want to share with us your slides?
Oh, sure. Yeah, just really quickly. And it's really going to reinforce what we've all been saying. I'll just move through them really quickly.
I think Holly has them.
Mm-hmm. And what I really wanted to do with these slides is, people are fearful of the vaccine. I want to put out the truth of what was found in these studies around symptoms you can expect. Symptoms that you can expect that are common, that you don't have to be scared of, because the symptoms really reflect your immune system responding to the actual spike protein that's being produced in your body. So I just want people to see some truth. I'm a visual learner, and I'll move through. This is just a reminder, this slide, of how much more Blacks, African American, Hispanic, Latinx, how much more frequently, and Native Americans actually die from COVID. So this, I would say 3%, 3 times as much mortality in the African American community. Next slide. And this is just a comparison, just a real quick glimpse of, we've talked about the mRNA vaccine and how it works. I compared Pfizer and Moderna, and again, the 2 doses. Pfizer 21 days apart, Moderna 1 month, 28 days apart. And Pfizer had participants 16 years and older. Moderna had participants 18 years and older. But both of them were found to be 94 to 95% effective after 2 doses, and at least 50% after only 1 dose. Both of them have gone through rigorous safety assessment and received their emergency use authorization and are being used. And a lot of people say, oh, it was so fast, I don't trust it. Well, you have to know that, just like Dr. DeHart said, there was science going on behind the scenes way before this pandemic that made use of mRNA seemingly happen fast. But you have virologists that have been working on the mRNA for years. It's their life work. And also the phases 1, 2, 3, the 3 phases in the trials, they were stacked. So instead of, phase 1 and then phase 2, they did have to do some things relatively simultaneously. And that may make it seem like it happened fast. It did happen fast. Let me say that again. It did happen fast, but not without the safety guidelines that every vaccine has to go through. And there were over 70,000 participants in phase 1, 2, and now 3, because they're still in phase 3. Next slide. And here's what I say to my friends and the people that I influence and my patients: expect this, because it was 85% in the actual study had arm injection. 84.1% had 1 to 2 days of pain at the injection site. If you don't, then wonderful. Muscle pain, 38.3%, injection at the injection site swelling, and so on. So there's some expectation that there is some discomfort, even systemically. So almost 63% of people had fatigue, 63% headache, chills, joint pain. So this is not to scare you, but just so if you have these symptoms, you won't think that something is wrong. Next slide. These are the uncommon or rare but serious and reportable things that can potentially happen. Anaphylaxis, and we've seen several people already, I think with Pfizer, maybe one with Moderna. Something called multi-system inflammatory syndrome, which is usually seen in children, that particular syndrome. Cases of COVID-19 after administration of the vaccine, resulting in hospitalization or death. Shoulder injury, and this is right out of their brief, so I didn't make this up. Shoulder injury or syncope related to vaccine administration within 7 days. And there's even been a report of something called Stevens-Johnson syndrome. Uncommon, rare, serious, reportable. Next slide. And you asked this question, who are the high-risk groups? And they call these vaccine recommended, but with discussion and consent. So that's pregnant or breastfeeding women, people with autoimmune disease, people who are immunocompromised, either because of cancer or an autoimmune disease where they're on lots of medications. So over time, we're still gathering safety data. So as people are starting to get immunized, there will be younger children included in some studies. There will possibly be known pregnant and breastfeeding women who are included in studies. Right now, they were not intentionally included in the first phase 1, 2, and 3. So there is no blanket statement. Basically, you discuss and get consent from people who are considered in those high-risk groups. The CDC and the advisory committee recommends the vaccine, but consultation with an OB doctor is still advised. Next slide. What's still unclear about the vaccine? Whether it's effective and safe for children less than 16, but they're going to start doing some studies in younger people. How long the vaccine protection lasts? Will we have to get it annually like we do with flu vaccine? We don't know that yet. And the safety and effectiveness in pregnant and breastfeeding women, but they will start looking at that closer as well. Next slide. We all were in agreement with this. Immunized patients should still adhere to all CDC COVID precautions, even once you get your vaccine, even when you get your second dose of vaccine. Mask, social distancing, hand washing, caution with high-risk contacts. The next slide. Next, I think that's it. That's it.
Thank you. We're getting some great feedback on those on that information. There's a question: can drinking lime water or eating lemons and breathing in hot steam be served as a home remedy? And I'm sure, as we're looking at all of the things that we have done, thinking about Black culture, we can create some concoctions to make some stuff go away. Is this an effective remedy or effective thing that we should be doing?
Well, I'll say this right here. Lime and lemons, what you're getting from that is vitamin C, which we know is beneficial to the immune system. But it's certainly not a treatment. It's not gonna, I don't want people to think that it will treat COVID or cure it, but certainly it'll provide to your immune system something important like vitamin C. And the hot steam will help open you up, but not cure or treat that I know of.
So anybody else have any, things that at the end of the day, we get these wives' tales, if you will. And so people kind of start, Facebook is a great tool, but in some ways we start to share all of these things that people have tried. So what are some things that you are recommending for, and anybody can answer this question, what are things that you're recommending for people? If I think Dr. Oyongo, I'm going to get it right. I think he kind of said earlier that there are some things that you could be doing at home, but we don't want to make it worse. So what are y'all recommending?
I think mostly just supportive treatment. At home, if you have a fever, you can take some Tylenol or ibuprofen. You can take some cough syrup if you're coughing too much. There's other cough medications to suppress the cough if it's keeping you up at night. So those can help. As regards to the other herbal remedies that are out there, people have talked about garlic, ginger. I'm not sure if those really help. But as long as you're not doing something in overuse, you're not overusing it to a toxic situation. I mean, if you want to chew on garlic or chew on ginger, that's up to you. But I don't think it's significantly helpful or curative, so to say, as Dr. Stanley mentioned. So I would just say that the regular things that we're used to is what you should do. Tylenol, Motrin, or something just to treat your fever.
You chewing on garlic, you won't have to worry about social distancing. Go ahead, Dr. Duggins.
The one thing that I always try to explain to people is that anytime you have anything that causes a fever, you have to remember you have to stay hydrated. Getting dehydrated is one of the worst things you can do. Sometimes you just feel tired, you feel sick to your stomach, you just you don't have the energy, you don't feel like you have the energy to get up and drink something, but you need to drink rehydration fluids. If that's just water, that's great, but you need to make sure you're staying hydrated anytime you have anything that's associated with a fever, because you can get dehydrated really fast and that can put you in trouble. So Tylenol, alternate with Motrin if you need to, but definitely stay hydrated. I'd push that over and over again. And one other point, I don't think anyone is saying that taking the vitamin is going to prevent COVID or is going to treat COVID. I think everyone understands that this is just boosting your system, and your system hopefully will then fight the disease.
So someone asked a question, is a Z-Pack or steroid pack good with helping with COVID?
So there's not really strong evidence for the Z-Pack. We do use steroids in patients in the hospital. And so, but I think that needs to be evaluated by a doctor before they can prescribe that. Because the treatment of it is slightly different, the dosing is different. So I would not necessarily recommend that people try those at home by themselves. I think you need somebody to guide you through it. Some patients might not qualify for it because the indication for it is patients who have severe disease requiring oxygen. That's when we consider steroids. So, but if you're at home and you're not that sick, then I think doing a steroid pack at home is probably not of much benefit to you. And if you really need a steroid pack, it should be in the hospital and being evaluated, more than being at home.
And I believe there's some evidence that if you use steroids too early in the infection, you can actually affect the immune system negatively. So I think the timing, like Dr. Olinga was saying, the timing of steroids is important. And generally hospitalization and the dexamethasone, that's later or with more severe infection, as I understand it.
And again, like we said before, I mean, there is no cure. There's not a cure for it. This is all supportive treatment. Just help kind of like minimize the inflammation in your lungs. So that's why this vaccine seemed like a game changer. It's a pivotal moment that we have to take advantage of and stay away from it, because there's nothing else that can protect us from the disease or cure the disease, so to say.
Just a clarification there again is that a Z-Pack is erythromycin, which is an antibiotics. Antibiotics do not do anything for the virus. Antibiotics does not stop a virus. It has no antiviral properties, and that's been shown over and over again. Now, if you get a secondary infection, yeah, most likely you need to be in the hospital so Dr. Yengo can take care of you. He will give you the right antibiotic.
Yeah.
So, and I think this has been said before, antibiotics do not affect a virus, and that is what this is. It's a virus, and so we want to make sure that we are giving correct information. Thank you, Dr. Duggins, for reinforcing that this is not, antibiotics do not help with a virus. All right, so last question is, if you're taking vitamin D, if you are taking those vitamins, how much is too much? What should we be doing? I know Dr. DeHart said if you can't take anything else, then at least just take a multi. But if I'm trying to, you said, Dr. Stanley, you said that most of us are vitamin D deficient. So what should I be doing?
Well, ideally, you should have a baseline vitamin D level drawn. So, because that's what really guides dosage for vitamin D3. A lot of times people don't have that benefit. I don't advise not taking vitamin D because you can't get
vaccine. It's safe. It's been proven safe. Continue to do your workout. That's one thing that a lot of people don't stop to think about. Stay hydrated. In addition to the vitamins that you supplement your body with, that's important also. So get the vaccine because it's good for you and it's good for the community. It protects you and those around you.
Dr. Stanley?
Yeah, I agree with everything that's been said. We are in a tailspin. It is dire right now. And the only way we're going to get on the other side of this without hundreds of thousands or more people dying, particularly people of color, is if we get this vaccine. We have to do it for ourselves and for our community.
Thank you all for participating. We appreciate you. On behalf of the Wichita African American Council of Elders and the Black Alliance, we want to make sure that we express to you, the community, how important it is for us to stick together. As someone mentioned, and Dr. Stanley mentioned earlier, we are in Kwanzaa. This is time for us to come together with collective work and responsibility. It is up to us to take care of the village. I also want to again mention that last week we discussed the impact that the pandemic had on mental health. So if you go to the Black Alliance page, it's not there yet, but it will be here in the next couple of days. We will have a mental health brief that you'll be able to download, that you'll be able to go on. There are resources both locally, statewide, and nationally for you to be able to get some information about mental health and things that you can do. There'll be some really nice little practices in there that you can do and use to make sure that you are staying on top of that. Again, www.wichitablackalliance.com or the Wichita Council of Elders Facebook page. And again, don't forget to use our text alert system by dialing 484848. This is Michelle Van, and we are so appreciative of you taking the time to be with us. Thank you to Roland Martin for live streaming. Without you, we would not be able to reach the amount of people that we have been able to reach, and we appreciate your platform for this discussion. Remember, we are on Facebook, we're in Periscope, we're in YouTube. Make sure that you go through, invite your friends, share with your friends. Even though we're over, there is a multiplicity of times in which Mr. Martin will share with you this particular show. And so we want you to make sure that you're sharing. Happy Kwanzaa, Happy New Year. Please stay safe, wear your mask, wash your hands, and stay away from other people. We love you, and we want to see you in 2021. God bless you.
It's a fact. African Americans have higher costs, hospitalizations, and deaths from COVID-19.
Come on, people, be smart. Avoid large crowds, wash your hands frequently, and mask up.
Going to crowded bars right now, it is dangerous for you and the people that you love the most.
Be patient. Those days will come back if we take extra caution for a few extra months. We've got this.
Keep the holidays safe for every generation of your family. Protect them and protect yourself. Mask up.